I think as much as like patients like sort of dread compression or don't like compression, it also has a lot of benefits. And I think like after a while, patients actually really realize that and it becomes less of an issue. All right, you guys, recovery Q&A. We are here for Lipstick and Lipo Live with two board-certified plastic surgeons. I'm Dr. Ashley Amalfi. This is Dr. Smita Ramanathan, and we are diving deep into the questions on our YouTube page. So thank you for those.
We love those questions. So keep them coming. But we are finishing up our recovery questions, right? How does compression make fluid go away? This is a
Whoa.
great one. Yeah.
I mean, so
Go for it.
compression really prevents excessive swelling. So compressive, if you don't have compression on the outside, when your tissue swells, there's not really an end point because it can keep filling with fluid and filling with fluid. Compression puts like a strict boundary on how much it can swell so that the swelling and the fluid go elsewhere in your body and drain normally, because in the surgical site, you're not going to have that normal lymphatic drainage, so you can keep puffing up and puffing up. So compression essentially acts as a barrier to prevent too much swelling so that your
Yeah.
results look nice and you're more comfortable too.
And also, there's swelling and there's little seromas, right? If we're doing
Yes.
liposuction, we create these little tracks that fluid can build up in and create little pockets of fluid or seromas, what we call them. And so the compression really sort of helps keep all of that tight so that fluid doesn't build up either in swelling or in a seroma form.
Mhm.
Compression is really important, and every surgeon has their own protocol. I think for us, we do a minimum of 6 months, but certainly up to 3 months in most cases. So
Yeah.
the more the better, but it's
And
really
you
a
want it
great
to
thing.
be smooth too. Like compression also helps things be nice and smooth so that they don't become like lumpy and bumpy as they heal. So various compression devices at various like time points, I think can be really, really helpful.
Exactly. And then with that too, to help with getting the fluid away, like in the question, we often combine that with lymphatic drainage, right? Whether it's
Yes.
lymphatic drainage massages, that will really help expedite and keep things nice and smooth and mobile, because skin, we want it to be nice and mobile for those natural, beautiful results.
I think you guys feel better too when you're not that swollen. Like, I think it just feels normal. It's like being puffy and swollen, like from any other reason. Like, it's not that
Not a good
comfortable.
feel. Yeah.
Yeah. And so I think as much as like patients like sort of dread compression or don't like compression, it also has a lot of benefits. And I think like after a while, patients actually really realize that and it becomes less of an issue.
Yeah, exactly. And people, there's sort of a flip, right? Where all of a sudden now they want to wear it all the time. And
Yes,
so
they're into it.
yeah, I see patients at like 9 months and they're like, oh, I still wear my faja. And I'm like, why? You don't need it. And they're like, oh,
Yeah.
I like it. And I'm like,
Yeah.
okay, that's
Yeah.
fine.
It's a thing.
Um, it's a thing. All
Yeah.
right. Ready for the next question?
Yes.
Okay. So this person, it's a tummy tuck and lipo question. Okay. So I'm 2 months post surgery from lipo and tummy tuck, and I noticed that I'm forming quite a bit of scar tissue along my incision. I was told to not start lymphatic massage yet. Is it too late to fix the scar tissue that has formed? So
Interesting.
we have scar tissues, scar tissue component, and then the lymphatic massage.
I mean, I am once drains and stuff are out, I usually am comfortable with people starting lymphatic massage. So for me, I do a few weeks. I know some
Same.
people do it even sooner, but I don't want those drains to be in for a long time. So the drains come out and then you start lymphatic massage. So I think, if your doctor is comfortable with it, it's probably a good time to start lymphatic massage. Um, let's talk about scar healing though. Like scar
Yeah.
formation is a normal process. So, like, not all scar is bad. And just because you're making scar doesn't mean it's bad. That's how your body heals. And so, at the time point of 3 to 4 months, that's exactly what I would expect. Your body makes a scar ridge, which is like a little mountain range under your incision. And all of those scar bands and collagen bands kind of make this little mountain range. And that's the time where your scar is actually getting stronger, and so it's safe to start massaging so that you can help those collagen bands lay down flat and not make that little bumpy ridge. And so I usually see patients around that time point, and their scar is going to be the thickest, the darkest, the reddest, and the hardest. And that's when we're going to start to be aggressive with massage so that we can sort of remodel all of that scar tissue at that time point. Are you nodding because you do the same damn thing?
No, of course I do the same thing because we literally do exactly the same
Okay,
all
tell
of
me
the
your spiel for scars
I
at that
just
time point.
I always tell Sumi, I tell my patients, I like the mountain ridge. I like that analogy. I'm gonna steal that one from you. But I listen, I always tell everyone your scars are always gonna look bad before they look good. And that is
Yeah.
part of the normal healing process, right? At 6 weeks, this sort of ties in why we have restrictions for you for those 6 weeks, because that's when scars are really gonna be the strongest that they will be,
Hmm.
strength wise, right? Which is really only 80% of normal uncut skin. So
Yeah.
at that point, they're going to be the strongest. And that's when you can start putting normal wear and tear, like normal activity stress on them, and there won't be any issues.
Yeah.
But after that, then they start remodeling. They like really build up that collagen. And that's when you start to feel that little ridge that develops and that
Hmm.
firmness. And then that's when we go over how to massage those scars, how to care for those scars. Um, and then progressively, slowly over the following months, things will fade, things will soften up. The scars will sort of blend into your normal skin tone. So it's a process. Scars are mature. You get your
Yeah.
final results after a year, but we even know that like a 3-year scar looks better than a 1-year scar, right?
Yeah.
So uh, be patient. It is all normal.
Normal, normal. And, that you should see your doc around that time so they can, you want to be doing all the things at that point because once your scars are like a year and a half old, like there's not a lot you can do on your end to really change them. So you want to be aggressive in your scar therapy early on, as early as it's safe to do so that you have honestly the best scar you can have. Because, like, when you get to a year or so and you're like, oh, I should have done that thing, it's kind of too late. So you need to start
Yeah.
protecting that scar right away. And if you haven't talked to your doctor about it, get back in the office and learn all the things.
Yeah, because there's other things we can do too, right? There's microneedling, there's lasers, there's
Lasers.
all these other things. If your scars are not going in the direction we want them to, that we can sort of reset them.
Yep,
So you should be having regular follow-ups with your surgeons at everybody has their own little schedule of when they have you come back. But these are all things that we address during your follow-up visits.
you got it.
Uh, all
Okay,
right, ready for fun?
you're,
Okay, so this is a question about in office procedures and getting conscious sedation and Valium. So uh, basically, my doctor uses conscious sedation and Valium. When you think about that, I'm worried I'm worried about how I will feel with the Valium, but they assured me that it's just to relax and so that I don't feel pain.
yeah. I mean, I think that it's perfectly normal to do
Yeah,
a combination of those things. I mean, even if a surgery is not really painful, like a little office surgery, you still get nervous because I mean, don't I even get nervous like when I go to the dentist because I can't see what they're doing. I don't know what they're doing. And so I mean, I imagine you guys feel the same way when we operate on you and you're kind of awake. So I think, anything that takes the edge off and makes you a little less nervous and a little more comfortable just makes the experience better because this is not torture. We're not strapping you to the table and doing something against your will. Like it's cosmetic surgery, it's kind of fun. So if
yeah,
there's things that we give you that make you a little more comfortable, I would say trust us and the ultimate goal is for your experience to just be better.
yeah. Yeah, I mean, I think you said it right on. Anxiety gets the worst of us, right? And so even when we're doing procedures under local and we're injecting the local medicine, the lidocaine, even though you're not feeling anything, you still feel the pressure and the movement, which
Yeah.
but then once you start getting anxious about it, it's just this like
Yeah.
spiral.
Yeah.
So trust your doctors. And the only other thing that I would say is if you are taking things by mouth or through the IV, you always want to make sure you have a ride home.
True.
Don't
Yes, you
drive
can't
yourself.
drive yourself. If we
Can't
give
drive
you
yourself.
anything, you can't drive.
Yeah. But it's perfectly normal. And that's a perfectly normal combination to give you to feel relaxed.
Yeah, do it. You'll love it. It'll be great.
I know. All right. I think that's it for our recovery and surgery
Love it.
questions. Yeah, we do have more questions, though, that we're going to get to on the
Okay.
next few episodes of Lipstick and Lipo. So we will see
Okay.
you guys next.
All right. We'll
Subscribe,
see.
follow us, and ask us more questions. We'll see you
Yep.
next week.
We'll see you soon. Bye.
Bye.